Hello, this is Jeff Edwards reporting for MSF OCB, Kibera project from Nairobi, Kenya. Today I'd like to present our NCD study, which is a retrospective case review. Prior to 2010, we saw an increasing frequency of non-communicable diseases, otherwise known as NCDs. This is primarily hypertension and diabetes. We put in place new diagnostic criteria and treatment protocols. And we looked at the cohort of patients that we enrolled in the NCD cohort between January of 2010 and June of 2013. The results showed that of that cohort, which turned out to be approximately 2,000 patients, 10% of the men and 12% of the females were HIV positive. This is consistent with the HIV rate in Kibera informal settlement. Additionally, we found that patients with HIV who were male were diagnosed slightly younger, at the age of 45 with either hypertension or diabetes versus those that were HIV negative at 53 years of age. HIV positive women were diagnosed at the age of 44 versus HIV negative at 47 with either hypertension or diabetes. The frequency of chronic kidney disease, which we defined as a creatinine clearance, less than 60 milliliters per minute, was 14% for the cohort overall. There was no difference in the frequency of chronic kidney disease between those with HIV versus those without HIV. The frequency of chronic kidney disease associated with diabetes was only 14% of those cases, which is lower than what we would typically see in developed countries. In addition, the mean age of chronic kidney disease for those with HIV was diagnosed at the age of 47 versus those without HIV, which was diagnosed at an average age of 59, which was significant. We did a sub-analysis looking at those with HIV and chronic kidney disease and the use of tenofovir, and there was no increased incidence of chronic kidney disease in those that were on tenofovir. Key outcome findings included blood pressure outcomes that were similar for both HIV positive and HIV negative. Loss to follow-up rate was lower in those with HIV at about 25%. For those that were HIV negative, it was closer to 40%. So in conclusion, what we found were patients with HIV were diagnosed with hypertension or diabetes slightly younger than those who were HIV negative. The frequency of chronic kidney disease did not appear to be associated with diabetes as high as it is in developed countries. The mean age of diagnosis for chronic kidney disease in those with HIV was 12 years younger than those that were HIV negative. Tenofovir was not associated with increased risk of chronic kidney disease, and treatment outcomes for hypertension were similar across both groups. Thank you. Hi, this is Jeff Edwards reporting for MSF OCB, Kibera project from Nairobi, Kenya. Today I'd like to present our study on rickets, which ran from September of 2012 through September of 2013. It's a retrospective case review study based on the diagnostic criteria and treatment outcomes of children with rickets. The problem with rickets is it's secondary to the lack of vitamin D, calcium, and sunlight exposure. Prior to September of 2012, we saw an increasing number of cases in the Kibera project. We put together new diagnostic criteria for the program, which included children under the age of 5 with widening of the wrists or rachitic rosary of the ribs, which are characteristic of rickets. This diagnostic criteria had been previously validated in another study and had a sensitivity of 89% and a specificity of 60%. Our results found that of 125 children that presented with suspected rickets, 82 were found to have met diagnostic inclusion criteria. 71% of the children had families that reported they had less than 3 hours of sunlight exposure per week. Rickets peaked with 29% of the cases being diagnosed during March and April last year, which is consistent with the rainy season. 2 out of the 12 villages that are within the Kibera informal settlement had 44% of the cases. 39% of the children were found to be malnourished based on MUAC measurements. 44% of the cases were found to have significant motor developmental delays on presentation. And lastly, during the treatment protocol, 40% were lost to follow-up, which is a characteristic problem of our Kibera population. So in conclusion, what we found was possible associated factors with rickets in Kibera include diet, malnutrition, lack of sunlight exposure, seasonal variation, and village of reference. Our recommendations are that MSF and the Kenyan MOH consider providing vitamin D preventatively to try and decrease the frequency of rickets in the Kibera project. Thank you very much.